Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, which investigated the effects of nebulized administration of dexamethasone and saline on lower airway inflammation in horses suffering from moderate asthma. The researchers sought to understand how this common corticosteroid, when delivered directly to the airways as a fine mist, might influence the expression of important inflammatory messenger ribonucleic acid, or mRNA, in these animals. Asthma in horses, much like in humans, involves inflammation of the airways, leading to symptoms such as coughing and increased mucus production. While managing environmental factors like dust exposure is crucial, treatments aimed at reducing this inflammation are also vital. Corticosteroids are a cornerstone of asthma therapy, working to dampen the inflammatory response. Traditionally, these medications are often given systemically, meaning they circulate throughout the horse's body. However, delivering the drug directly to the lungs via nebulization could potentially offer benefits by targeting the inflammation more precisely and minimizing systemic side effects. Previous research has explored the use of nebulized dexamethasone in healthy horses, suggesting it does not readily cause airway inflammation and has limited absorption into the bloodstream. However, studies in horses with severe asthma have shown that nebulized dexamethasone at a dose of 5 mg daily did not improve lung mechanics, although it did suppress the horse's own cortisol production. This led the researchers of the current study to question whether a higher dose of dexamethasone, specifically 15 mg administered once daily via nebulization, might be more effective in horses with a less severe form of the disease, classified as moderate asthma. The study involved 16 horses with naturally occurring moderate asthma and 4 healthy control horses. All horses were kept in a dusty environment throughout the 13-day treatment period. This was a randomized, controlled, and blinded clinical trial, meaning the horses were randomly assigned to treatment groups. One group received dexamethasone, another received saline, and the control group received no treatment. And the researchers evaluating the outcomes were unaware of which treatment each horse received. The main goal was to examine changes in the levels of various inflammatory cytokine messenger ribonucleic acid in the fluid obtained from the horse's lungs through a procedure called bronchoalveolar lavage, or BL, before and after the treatment period. Cytokines are proteins that play a crucial role in regulating the immune system and inflammation. The researchers hypothesized that nebulized dexamethasone would suppress the inflammatory response in the asthmatic horses, while nebulized saline would have no significant effect. They also anticipated that keeping the healthy horses in a dusty environment would trigger an immune response in their respiratory tracts. Now let's turn to the results of this important study. Regarding clinical signs, the researchers observed intermittent nasal discharge and coughing in the asthmatic horses, both at rest and during light exercise. However, they found no significant difference in cough scores between the treatment groups over the course of the study. Measurements of dust concentrations in the stable environment showed a consistent pattern related to daily animal care activities. When examining the amount of mucus in the horse's airways using an endoscope, the study found no significant changes in any of the groups, including those receiving dexamethasone, saline, or no treatment, between the start and end of the study. Similarly, the analysis of cells collected from the bronchoalveolar lavage fluid revealed no significant differences in the proportions of different cell types, such as neutrophils, eosinophils, and mast cells, between the treatment groups at the beginning of the study or within each group after the 13-day treatment period. Interestingly, however, by the end of the study, 3 out of the 4 healthy control horses showed signs of developing airway inflammation in their cytology. The researchers also measured the levels of cortisol, a natural steroid hormone, in the horse's blood. They found a significant decrease in cortisol levels in the dexamethasone-treated group by days 7 and 14, and a temporary decrease in the saline group by day 7 only. The most striking findings related to the expression of inflammatory cytokine messenger ribonucleic acid in the bronchoalveolar lavage fluid. In the horses treated with nebulized dexamethasone, there was an increased relative expression of several pro-inflammatory cytokines, including interleukin-5, interleukin-6, interleukin-17, interleukin-12, and tumor necrosis factor alpha after the 13-day treatment period compared to before treatment. Conversely, they observed a decrease in the relative expression of interleukin-23 in the dexamethasone group. In contrast, the horses treated with nebulized saline showed no significant changes in the relative expression of any of the investigated genes over the treatment period. When comparing the dexamethasone-treated group to the untreated control group at the end of the study, the horses receiving dexamethasone had increased relative expression of interleukin-1 beta, interleukin-6, interleukin-8, interleukin-17, interleukin-23, interferon gamma, and tumor necrosis factor alpha, and decreased relative expression of interleukin-10. Comparing the saline-treated group to the dexamethasone-treated group at the end of the study revealed that the saline group had decreased relative expression of interleukin-1 beta, interleukin-5, interleukin-8, interleukin-12, interleukin-23, interferon gamma, eotaxin-2, and tumor necrosis factor alpha. Finally, when comparing the saline-treated group to the untreated control group at the end of the study, the saline group showed decreased relative expression of interleukin-5, interleukin-10, interleukin-12, and eotaxin-2, and increased relative expression of interleukin-17. The healthy control horses, after being kept in the dusty environment for 13 days, showed a downregulation of interleukin-23, interleukin-4, interleukin-5, interleukin-1 beta, and interferon gamma, and an upregulation of interleukin-10, interleukin-12, and tumor necrosis factor alpha. The discussion of these results offers valuable insights into the complex interplay of treatment, disease, and environment in equine asthma. The most unexpected finding was that nebulized administration of dexamethasone was associated with an increase in the expression of several inflammatory cytokines in horses with chronic airway inflammation. This was observed both when compared to the control horses and the asthmatic horses treated with nebulized saline. This is contrary to the expected anti-inflammatory effects of corticosteroids. The researchers considered several potential explanations for this observation. One possibility is the higher dose of dexamethasone used in this study, 15 milligrams daily, which was greater than the 5 milligram dose used in previous trials involving horses with severe asthma. While a lower dose might be anticipated for local administration, the lack of improvement seen with the 5 milligram dose in more severely affected horses prompted the use of a higher dose in the study of moderate asthma. It is also possible that the preservatives in the dexamethasone sodium phosphate solution could have contributed to the observed immune response. A previous study noted coughing in some horses with severe asthma during nebulization with this formulation, suggesting a potential irritant effect of the vehicle. Another contributing factor could be the prolonged exposure to increased respirable particulate matter in the dusty environment, which appeared to induce inflammation even in the healthy control horses. This is consistent with the understanding that stabling is a known risk factor for airway inflammation in horses. Interestingly, the treatment of asthmatic horses with nebulized saline was associated with a downregulation of several inflammatory cytokines when compared to the dexamethasone-treated group and the untreated healthy control horses. Furthermore, there were no significant changes in gene expression over time within the saline-treated group itself. Given the shift towards a T helper type 1 immune response observed in the control horses due to the dusty environment, the lack of inflammatory upregulation in the saline group might suggest a subtle beneficial effect. While nebulized saline is often used as a placebo, it has been shown to potentially improve mucociliary clearance in human patients. The study also points to previous findings suggesting that nebulized saline can reduce the presence of certain bacteria in the airways of asthmatic horses. However, any potential benefits of the saline nebulization in the study were not strong enough to overcome the inflammatory effects of the dusty environment. The study's observation that prolonged exposure to a dusty, stabled environment led to the development of airway inflammation and a shift in cytokine response in the healthy control horses highlights the significant impact of environmental factors on respiratory health. This finding underscores the importance of managing air quality in the prevention and treatment of equine asthma. The researchers acknowledge that the small number of horses in the control group is a limitation of the study, which could have limited their ability to detect other potential cytokine changes. In conclusion, this research demonstrated that while nebulization of a lower dose of dexamethasone does not induce lung inflammation in healthy horses, a higher dose of 15 milligrams was associated with a mixed inflammatory immune response in horses with moderate asthma. In contrast, nebulized saline reduced the expression of several inflammatory cytokine messenger ribonucleic acids in asthmatic horses, although it did not improve the cellular signs of inflammation. The study reinforces the critical role of improving air quality as a key component in managing equine asthma. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.